morning, you guys. I'm on my way to my second day of rotations for the week. Right now, my car time still isn't working. So, yeah. Don't know what time it is, but I'm pretty sure it's about 6:20 in the morning. I have to be in the OR around like 6:30, 6:40-ish. Because my preceptor told me to be there an hour before the first surgery starts, which is at 7:30. So I'm gonna try and get there as quickly as possible. I'm about 5 minutes out, hoping I'm able to get there in time. I should be there in time. I plan to be there in time. They asked me to park in the back this morning, so that's what I did. So yeah, time to go in. So, we have officially ended day 2 of my anesthesia rotation. Day 2 of my first rotation. So early this morning, I think I talked to you guys about how I was supposed to get there at 6:30 and get there earlier than I did the day before. Because on my first day I got there around 8 a.m., but this morning I got there at 6:30. And so I made it just in time, which was nice. But now let's talk about the day. So today, we were originally scheduled to do 4 cases. So the first 2 cases that we did were pretty cool. They were orthopedic spine cases. And so for these cases, the patient had to be laying prone, which means that their stomach side is down in order to, expose the portion of the spine that the surgeon wanted to operate on. And so that was pretty cool. And getting to watch them prep the patient for surgery, and then ultimately flip them over, and just seeing how much teamwork went into getting the patient ready for the procedure. After the spine cases, we did a pediatrics case, and it was a pediatric endoscopy and colonoscopy. So endoscopy, you've got either a surgeon or a GI doctor. In this case, it was a GI doctor who went down the esophagus in order to perform the endoscopy and take a look at the stomach and the small intestines. And then after that, they performed a colonoscopy, which is going up the other end, to take a look at the colon and some of the more distal portions of the small intestine, which are the portions that are, closer to the colon, so like the ileum. So that was pretty interesting to get to see that case. Actually, right now it's just like a little bit after 2. I ended up getting out early because I guess the patient ended up showing up a little bit late. And so my preceptor just said, hey, if you want to, head out early, go home, do a little bit of studying in, go ahead and do that. And so I was very grateful because, I'm still studying for boards. I try to take any opportunity that I can to study for boards to help prepare myself. And so I appreciated that. And so now I'm just heading home, and I'm going to go ahead and study. But yeah, day 2 was nice. The anesthesiologist who I'm working with, for the past couple of days I've mainly been doing a lot of observing, but he says that I'm going to get a little bit more hands-on experience now. So hopefully I'll get to start helping a little bit more with some of the ventilation, and maybe even get the opportunity to intubate a patient as the weeks go on. But yeah, that's pretty much the end of day 2. I'll talk to you guys later. So we just ended day 3 of my first rotation, anesthesia. Still enjoying it. So let's go ahead and talk about what I did today. So today I got to do some pretty interesting things. Some of the cases that we did 2 cervical spine cases, and then we did a gallbladder removal, which is really cool. It was a laparoscopic gallbladder removal, and we did a lipoma removal. And so a lipoma, all right, sorry about that. And so a lipoma, it's a little tumor. It's not malignant, it's a benign tumor, but it's just like a little clump of fat that's underneath the skin. And most of the time, general surgeons can go in there, and sometimes I think dermatologists sometimes do as well. But today it was a general surgeon went in there and cut out the lump of fat that was on the patient. And so that was the lipoma removal. And I got to learn some pretty interesting hands-on stuff while we were doing those cases. So one thing that my preceptor started letting me do more, today he taught me how to draw up some of the drugs into the syringes that they use when anesthesiologists inject drugs into the IV. So he taught me the proper way to draw those up, which is pretty cool. How to make sure that I keep things sterile if they need to stay sterile, and figuring out the proper way to get that done. Another thing that I got to do, I got to practice mask ventilating patients again. Oh, there are rocks coming off of this truck and they're hitting my car. I gotta switch lanes. Yeah, I don't want these rocks hitting my car. Alright, that's better. Let's see. What was I talking about? Oh yeah, I was talking about how I was learning how to draw up the drugs. Another thing I got to learn how to do, speaking of IVs, was he taught me the basics of how to place an IV. And so pretty much what he did, I didn't get to place an IV today into the patient, but I did get to, took out like the IV needle and pretended that the bag, the container that the IV needle came in was pretty much a vein, and taught me the proper steps. And so I just kind of like sat and practiced on that over and over again, how to practice placing an IV. And so that was pretty cool to get those steps in my mind. Oh, that's what I was talking about. I was talking about mask ventilation. Yeah, I got to practice mask ventilating the patients more. I'm getting a little bit better at it. Sometimes I get nervous that when I go to ventilate the patient, because you really have to get underneath their jaw and push it forward to make sure that the airway is open enough so that the patient is getting air anytime, when you get a good seal with the mask, and make sure that air is actually getting to the lungs and ventilating the lungs. And so I was kind of nervous because you really have to get in there and not be afraid to manipulate the patient's head and manipulate the patient's jaw however you need to in order to get that. But I'm getting a little bit better at it, getting a little bit more comfortable with it. Oh yeah, I found out, so when it comes to intubating the patient, use what's called a laryngoscope, but it's what you stick down into the throat in order to lift up the epiglottis, which is what prevents food from going down the wrong pipe. So when you breathe in air, you're able to get air down the trachea, and when you eat food and swallow, you open up the esophagus and get food to go down there. And the epiglottis is what prevents food from going down the wrong thing, going down the wrong pipe. And so the laryngoscope lifts up the epiglottis so that you can see the vocal cords, and then you can stick the endotracheal tube, which was used for the intubation, down to the trachea. And so I got to do that for the first time. And so that was pretty cool. Wasn't very successful with it. I struggled a bit. But thankfully, my preceptor guided me through it, which was cool. And what I found out is that the laryngoscopes, the blades that they have, there are cameras on top of them. So instead of having to stick the blade down in, push up the epiglottis, and look at the vocal cords by just looking into the mouth, you can actually look up on that little camera to make sure that you've really got good visualization of the cords before you stick the tube down in there. So it was really cool to get to see that. I'm trying to think of what else. Oh yeah, as far as timing. So we actually got done pretty early. I got in at around 6:30 this morning. Got in right on time. Literally walked in as my preceptor was walking in too. And so got there just in time. got there around 6:30 this morning, and then we did the last intubation around 11:30. My preceptor said, like, oh, well, do you want to go on and head home? You know, this is the last case of the day. So where do you want to stay? And that was the laparoscopic gallbladder case that we were going to do. And so I decided, you know what, it's only like 11:30. I still want to keep learning. I'll go ahead and stay. And so I told him that I wanted to stay in the OR. And it ended up being really cool. The surgeon who was performing the gallbladder, he talked me through all of the anatomy and talked to me about some of the technology that they used during the laparoscopic surgery to remove the gallbladder. So it was really cool that I got to see that. And at the end of it, after they took the gallbladder out, the surgeon calls me over. He says, like, hey Joe, why don't you put some gloves on and we'll cut open this gallbladder and see what's inside. I was like, oh, cool. Because, you know, the last time that I saw a gallbladder was in my anatomy class. And so this was a really cool opportunity to see the gallbladder. And I got to put on some gloves. I got to cut it open. And we got to see, you know, some gallstones inside. So that was a really cool and unique opportunity that I got. So it just goes to show, when you decide to stay and do extra work, you never know what opportunities will present themselves and what you'll get to do. I'm gonna go to the gym, hopefully get a good workout in. After that, I'm gonna head home and keep studying for my boards. So I will talk to you guys later.